Now, for next, we are looking at what is now the Transvesical Botox Injection. So let's quickly define terminologies before we go in. Now, trans is like we are putting something through something. Vesical is just another name for bladder. Botox is another name for botulinum. So for the botulinum, I don't really know much about it, but I just know that it's an injection that way you give it to paralyze something, it to cause something to be relaxed, you know. So sometimes if your bladder is contracting too much, you might actually need to give this injection just to relax the bladder, you understand. So that's the basis and application. So it just involves you are trying to deliver botulinum toxin directly into the bladder wall, because you want to treat a bladder that is now contracting too much. Okay, that's what they call the overactive bladder. So also you can use it in treating some certain types of urinary incontinence where urine is kind of like just leaking out. So what is transvesical Botox injection? It's a minimal invasive procedure. Botulinum toxin type A will now be injected into the bladder. So normally you put a cystoscope first, then the injection will be passed through it, you understand. So the transvesical just simply means you are giving the injection into the bladder wall. Target is the detrusor muscles, which are the ones causing the irregular contractions, so this will help to relax them. So mechanism of action is this: Botox will block acetylcholine release at the neuromuscular junction, so this will inhibit involuntary bladder contractions. This will improve bladder storage capacity. Okay, so well, it will help to relax the bladder for a very long time, 4 to 6 months. Okay, so it's used in treating overactive bladder, used in treating neurogenic detrusor overactivity, used in treating conditions where urine is just leaking out like that. Okay, so it can have some side effects. Side effects include sometimes from being too relaxed to being too it can cause urine retention, right? Okay, so sometimes you have to catheterize the patient, which can put them at the risk of having urinary tract infections, okay, bleeding in urine, and also pain on urination.